Hi, I'm Dr. Ashley Metcalf, Pediatric Emergency Medicine Physician at the Johns Hopkins Hospital. When we opened the doors to our new Charlotte R. Bloomberg Children's Center in May 2012, we launched a new era in accessible, patient and family-centered emergency care for children in the Mid-Atlantic region. Only minutes from I-83 in downtown Baltimore, our new Pediatric Emergency Department features a walk-in entrance, valet parking, an adjacent parking garage, and a covered footbridge from the garage to the new hospital. In addition, we have a covered, weather-protected 12-bay ambulance area. Our family lounge area, like the Bloomberg Children's Center itself, is airy and comfortable for parents and stimulating and playful for patients and siblings. Frontline registration staff are experienced and trained to ensure a smooth and seamless admission to the emergency department. Our customer service care coordinator, a new position in the Children's Center, is there to aid you and answer any questions. Our goal is expedited emergency care for children with less stress for them and their families. That's why we've designed separate triage rooms and a quick sick area. With our new, dedicated, state-of-the-art pediatric trauma bays, we are better able to provide emergency care designed specifically for children. Kids are not just little adults. They have different emotional and developmental needs, and they require different sizes of equipment and medication doses. They need emergency medicine facilities designed for children and emergency medicine professionals, especially trained in pediatrics. Maybe that explains why we're the official pediatric trauma center for the state of Maryland, receiving patients from Cumberland to the Eastern Shore, as well as from Pennsylvania, West Virginia, Delaware, Washington, D.C., and Northern Virginia. We're about patient and family-centered care. After being triaged, patients will find themselves in an all-private exam room with comforting artwork, lots of space for family members to relax, and amenities like DVDs and a TV. Of course, private medical rooms serve clinical purposes too, like minimizing the risk of infections. We also offer specialized medical services in our pediatric emergency department, like 24/7 pediatric ophthalmology and dedicated pediatric radiology services that expedite imaging, minimize radiation risks, and maximize accuracy in interpreting images for patients and families. Thanks to a very proactive child life service here at the Children's Center, we have dedicated child life specialists in the emergency department who, through interactive dolls and other distraction techniques, help minimize the psychological and emotional trauma patients may experience. These child life specialists have the ability to explain to young children, in terms they understand, how they will be evaluated and whether they will have to undergo a procedure. They are an invaluable resource for our young patients, especially those making their first visit to the emergency department. Of course, the emergency department's clinical staff is our best resource for seriously ill or injured children. Dr. Doug Baker, Chief of Pediatric Emergency Medicine, has made his #1 goal building a premier pediatric emergency department. We have highly trained pediatric emergency medicine physicians and nurses, as well as access to a variety of pediatric specialists.
Well, we're glad that you've taken this quick video tour of our new Pediatric Emergency Department. As Chief of Pediatric Emergency Medicine here at the Children's Center, I'd like to stress that we not only have expanded our space, but we have also tripled our staff with national leaders in pediatric emergency medicine. In addition to caring for your children, our faculty physicians are actively involved in research in areas like injury prevention and the management of infectious diseases. We have a nationally recognized child protection team devoted to recognizing and treating victims of child abuse, and our nurses are educated, trained, and certified in pediatric emergency nursing. In the Johns Hopkins Children's Center, we also have access to a full array of world-class pediatric specialists for quick consultation. At Johns Hopkins, our philosophy is to engage you and your pediatrician in the care of your child.
Easy patient access, a family-friendly environment, and a new, state-of-the-art pediatric emergency department, specialized pediatric services, staff who are national leaders in their field, and strong relationships with community pediatricians. What else would families expect from Johns Hopkins Children's Center?